present you the patient that we're gonna do the surgery, how we planned her, and this one actually is a very favorable case also. You're gonna see it. But the most important here is for us to really make you understand why we do it this way in terms of planning, and the guides that we use, the click guide system that we developed, why we did it, and how we work with it, right? That's the most important. And it's the same for all the patients, right? So here we have Angelis, our dear patient that I'm gonna see in a couple of minutes. We can clearly see that, of course, she needs an upper full arch bridge, but she also needs a treatment on the lower, and we did plan that. We did design the lower. We're gonna see it, right? But for the course, we're only gonna be treating the upper arch, right? And then we're gonna probably she will come back on the next course. It's a big chance that she's gonna be the patient for us to demonstrate the final bridge on the upper, which we're gonna show also today later on the afternoon, the other patient. And maybe we can do the lower on her, right? It's a case for probably full mouth on the lower also, because she has some, you know, not many teeth, and they have problems already. So that's the plan. Today we're gonna only work with the upper, okay, but having the lower in mind for the future. So she has a denture, of course, an old denture in place. We can see that the denture it's not in good shape, you know, canted, small teeth, you know, which is very normal for dentures, right? It's very common. So, but we always use the dentures as reference. The dentures for us to plan a dentalist patient is like having the teeth, right? It's the link. It's the link for us to be able to design and plan the case. If we don't have the denture, the patient will not show the ridge on the picture, and we cannot overlap things. And even the CBCT also, many times it's hard to overlap the ridge on the CBCT. So we usually we recommend, and we strongly recommend, to always use the denture as the linking part of the different pieces that we need to plan, right? The pictures, the STL, of course, and the CBCT, okay? For us to be able to use the denture properly, it's very important for this denture to be well adapted on the ridge. So we always recommend to reline the denture inside, okay? And then you scan the full denture, right? So we have a perfect copy of the soft tissue. And we can even use this as the soft tissue, because many times to scan a full arch, dentalus arch with an intraoral scanner is not very easy, right? So it's relining the denture is like making an anatomical impression. It's so that's what we usually do. Okay, that's what we did for her. And then for the CBCT, the ideal protocol is to have the double scanning. That's the ideal. Right? That's the only way to guarantee a perfect overlapping. Many times we can overlap without the double CT. Yes, we can, depending on how much of the air inside the mouth, because what makes everything very difficult is when the tongue touches the palate, when the cheek touches the ridge, so you don't see where the soft tissue is on the CBCT. So that's why the double CT scan is very important. So, which is marking the denture with some opaque material. So we recommend gutta percha, which is super simple, cheap, and so make some marks on the buccal, on the palate. We're gonna show this later on also, Chris. And scan the patient with the denture on, relined. Another important thing about relining is that we guarantee that the denture doesn't move during pictures and the CT, because if the denture moves, then we lose the reference. We will be linking things that are not correct. Okay, so very important for that reason also. So make the CBCT with the denture in place.
With retractors?
Would be perfect. The retractors are something new that we are recommending to separate the chick, but less important if you are doing the double CT scan. Okay, but still, I would do it as a protocol for all the patients. CBCT with retractors. Okay, and then scan only the denture. So you place the denture over the support of the chin, and you scan only the denture. The CBCT, only of the denture. So then the software, when you place both things on the software automatically align both, poof, in a very precise way. Okay, so just to have you give a...
Those retractors for the CBCTs are, you can put them into the mouse and then they hold by themselves.
Yes, yeah, those for pictures, the plastic ones, but not the ones that the patient needs to hold, but the ones that yeah, there you go. I like also the ones for bleaching, you know, the ones for bleaching. That has also something to hold the tongue down. It's perfect. And keeps the both arches apart, which is also better. So CBCTs don't need to be in occlusion. Actually, it's better not to be in occlusion. So we're not going to use the CBCT for the bite information. We're going to use the STLs. So we don't need the CBCT to be in occlusion. And it's better to be apart because we can overlap better the files. Okay?